We are Christina,
Oneida,
Alicia,
Colleen.
Welcome to 4NP's podcast.
This is a podcast by 4NPs. 4NPs, advanced practice nurses, students, and anyone interested in the medical arts.
That's the number 4 NPS podcast.
If you have a topic you'd like to see covered, please feel free to email us at 4npspodcast@gmail.com or reach out to us through our social media.
Hi, everybody. Thank you for joining us. Today, we wanted to talk with you about imposter syndrome. It's very common to feel like you don't know what you're doing when you first start practicing. And in fact, you can feel imposter syndrome if you've been practicing for 20 or 30 years. So it's very common. So hi, ladies. How are you?
Hi. Good. How are you?
Good.
Doing good.
So do you guys ever feel like you have imposter syndrome?
Yes. Yeah, I think it's a hard thing to like kind of that you struggle with, but you're not like really sure you want to be accepting of it. Like, you know, it's reality, but at the same time, you also understand that you get through it because it's especially if it's a new role that you've had to enter into, and it's always going to be hard when it's a new role and you have to get adjusted to, you know, figuring out your way and your path and how to do things differently and being open to that, but it still makes you feel bad sometimes when you just don't know everything.
Oh, so bad. I remember just, especially, I think being in a field that you really know nothing about. Like I started in oncology and hematology, just having to learn all of that and then not really feeling comfortable with that knowledge and then going in and seeing patients and just feeling like a fraud because, you know, they're coming to see me and I'm supposed to have all the answers and I don't even feel confident in my knowledge. So it's difficult because you don't know if you're portraying to them your confidence enough for them to have confidence in you to feel like they've come to the right place for help. So it's a struggle.
So I was looking a little bit about this online and I wanted to know what the signs and symptoms of it were. And what I found was it said anxiety, perfectionism, self-doubt, and fear of failure. And I feel like I had this as an undergrad nurse also. And I do remember someone in my life who's a nurse saying to me, wait until that day comes that you realize that you're a nurse, that you're going to have a day that you realize that you're a nurse and you can remember where you are. And I wonder to myself if what she was describing, and I do have that day, but I wonder if what she was describing was imposter syndrome. And this is going back before, like when I was very new going to nursing school, that she had kind of planted that seed of like this, that something is going to occur, that I'm going to be uncomfortable in my own skin for a while. And then I'll have like some sort of epiphany of like, oh, by the way, I'm a nurse. And then, you know, to have that happen again as a nurse practitioner. Did you guys have that? Did you have that as an undergrad nurse also?
Oh, yeah. Like I remember interviewing with Anne and I remember her saying, you're not going to feel comfortable in your skills. Give yourself a year. And I think that was like the best advice because if you don't hear that and you feel like you have to know what you're doing, it's debilitating because you don't and you're not going to because you haven't had enough experience. So I'm so thankful to her that she had the presence of mind to say that. And I'm sure she said it to everybody, but I'm just so blessed that that's where I started.
Did you feel like it took you a year to feel like...
Oh my God, it probably took me longer than a year. Yeah. Where you go into a patient's room and you're like, you don't know what the medications are. You have an idea of what the medications are. And then the patients are asking you questions and you're like, but those experiences also being uncomfortable, like I always find that I learn the most when I feel uncomfortable because it pushes me, it drives me to be better.
I agree with that.
Yeah.
I think too, you know, we're all going to experience that whatever stage in life we are based on, you know, our experience with whatever it is we're doing. But I think it's important to also listen to our patients and almost be open to letting them know, hey, listen, I'm not really comfortable with this, or I'm not too familiar with this, but I'm willing to like investigate whatever I need to investigate, because sometimes too, you are faced with patients and you don't want to blow smoke up their butts, and act as if you know something you really don't, because that almost puts you in a worse position. I find, and I still find, that there's instances where I'm not going to know everything, and I'm not going to sit there and act as if I do. But what I do also find is when I'm honest and I'm like, listen, I'm going to figure this out. We're going to work together. We're going to do the next step, whatever that next step is. I'm going to inquire more about it, because sometimes I'm in a room and they'll ask me something and I'm not sure.
Right.
But it doesn't mean that I can't find out, and I'm not going to work hard to figure it out.
Right.
So I think it's also, and that helps make you feel like, okay, I don't have to know everything right at this moment. I'm not going to know everything, and that's okay. But as long as you're honest and you can express that to your patients, I think it's important.
I think it's also very important. And I think that because your patients are going to know if you're trying to BS them.
Or if you're pushing medication on them. And I'm like,
Right,
I'm not
right.
about pushing medications. I'm sorry, I'm
Right.
not. And I don't think that's the answer.
Right.
We'll figure out what the answer is, but it may not happen right at this moment.
Yeah. And I think the key is feeling confident enough to say, I don't know, but I'm willing to look up the information or ask my provider or whatever.
Yeah, consult with other providers. Absolutely.
Right, right. And I think it's funny, like the less that we know, like just starting out in nursing or starting out as a nurse practitioner, you feel like you have to know everything. So you almost ask less questions because you don't want to feel or let other people know that you don't know. And then the more confident that you get in your knowledge and your role, you feel more comfortable asking questions because you're okay with not knowing. You know that everybody doesn't know everything, and you feel comfortable asking the questions, which is so important. You have to ask the questions. You have to feel comfortable doing that. Don't be afraid. Nobody knows everything. And your patients are going to be so grateful that you did ask the questions. Because, I mean, if you don't ask the questions and you pretend that you know the answer, it leads you down a very bad path.
Mm-hmm.
Yeah. I know that when I was doing clinicals with, and I'm going to shout out because I know she listens, Kim DeRigo, you're awesome.
Hi, Kim.
And I did clinical practice with her. She's a primary care nurse practitioner in Orange County, New York. She's awesome.
Yes.
And two things that I really got out of working with her, and she was so honest with me, and I really appreciated that. One of the things was that she definitely would say to her patients, I have no idea what that is, but let's take a look. Let's look it up. And she would bring up something on the computer right in front of them, and she would read about it with them and educate herself and them at the same time, which I thought was so cool and so real, just so real. And she's very experienced. And so she is very experienced, and she's still, was doing this. And the other thing that I also witnessed her do, and she may not know this, but I did witness her do it, is that somebody had a more complicated case. And so she would think about it throughout the course of the day. And she had her visit with the patient, and the patient left, and she provided a plan of action for them or plan of treatment. But then she would call them back later in the day and say, I had this thought, let's do this. I'm going to add this to your blood work, or let's look at it this way. So I loved that, because it is, sometimes you have to process it, and you got to think through it. It's complicated. It's not just the simple answer. There's something more complicated going on. So it was really great for me to witness somebody and to be taught by a clinical preceptor who was like that. She just was so real and honest. And she's my nurse practitioner, so I think she's great. Obviously, she has been for a long time. But it was nice of her to teach me that. She didn't teach me from a position of where she was going to be a teacher who just knew everything, or like she wasn't going to teach from that angle. I've come across nurses like who, they always had the answer.
Right.
She was just honest and real, and that's just the way it was. And I love that about her. And I thought it was great to learn under somebody like that. And it says a lot. It taught me something, like that it's okay to not know that.
And it is okay to not know.
Yeah.
And I did that often, taking care of patients. You go throughout your day, you see the patients, later on you're still thinking about the case, or maybe you've talked to the provider. Every patient I ever called and said, listen, I've been thinking about it. They were all appreciative that I called them, and I don't think that it's a bad thing to do that.
No, I've done that. I have patients have left, and I've been like, wow, I'm not really sure about what my recommendation at that moment. I think we should, change it. So I'll call them and I'm just like, listen, this is how I'm feeling. And they're like, okay, I whatever you say, I'm going to follow, and because they do appreciate that you're not like just rushing into something. You actually sat back again, thought about it, and was like, no, this doesn't seem like it's the right decision.
Right.
So it's not so much that they don't have trust in you. I think they more so do because you're actually reevaluating it to make sure that that plan of care really actually fits their potential diagnosis.
Right.
So, yeah.
Yeah,
right.
I agree. So have you had that moment, each of you as nurse practitioners, where you felt like you're not an imposter? You realize that you're a nurse practitioner, like you're the real deal.
Yeah, on Monday, I usually feel that way. On Tuesday, I feel like I'm an imposter.
Oh, Rita, that's important. That's important for this podcast to get that across. So Tuesday's imposter. It starts imposter day of the week.
It's Tuesday, right? I dress up as an imposter and I go to work. And
Tuesday through Friday, or do you have like Wednesday?
Friday I am golden.
Day?
No, Friday I'm just ready to go. Like hit the weekend. I feel good. I'm not impostering.
So that's good. So Fridays and Mondays you're not an imposter,
No.
but at the other days of the week, forget it. Yeah.
You should see more patients on Mondays and Fridays.
Yep. I would make Tuesday through Thursday your administrative days.
Yeah. Load your patients.
You need to renegotiate your contract. Sorry, I have imposter syndrome on these days, so I'm not going to be seeing any patients.
I'm not going to be as
I'm gonna
effective
chart.
as Monday and Fridays. Book me up on Mondays and Fridays.
Right. Monday and Friday, back to back.
Oh, God.
That's so funny.
I find that now that I'm in GI, I feel less like an imposter. Doesn't mean that I don't have my days where I feel like I am an imposter, but definitely knowing the subject, being more comfortable with it, it feels better. But again, I have those days where I'm like, I don't know, where I have to lean more on my physician, or I have to lean more on the PA that I sit right next to, which is amazing. I think it's just important to have that support staff around you, because you're going to have those moments where you're like, who am I? Am I really a nurse practitioner? So you have to have those people to lean on. And also, I think that when you start working as a nurse practitioner, you have to really lean on the apps like UpToDate and Hippocrates. And I find that it's made such a difference. And I think when you are beginning your role as a nurse practitioner, you don't really understand, you don't feel confident in your role, right? So you don't really know what you're doing, and you don't feel confident in making the choices for your patients. And I don't think that you realize that the doctors that you're working with are depending on you to make those decisions. And I feel like when you first start, or that's how I was, I asked a lot of questions. And I'm sure some of them were just common knowledge, but you feel like such an imposter that you want to make sure you're taking care of these patients. These patients' lives are in your hands. So you just want to make sure, double check, triple check that what you're telling them is the correct information. And I think when I first started, I didn't use UpToDate as much as I should have used UpToDate, because I didn't get it. I didn't get the role. I didn't get that, I didn't get that this is what the doctors are doing, They're using UpToDate. It's not, some of them, they've been doctors for decades, centuries, whatever. So they do know. They do know the information. But they're also leaning on UpToDate and all of these Hippocrates, and they're leaning on that as well. That's where they're getting their information. There are guidelines that they have to go by. They're not pulling it out of the air, So I think you need to realize that there are guidelines that you go by. As long as you follow the guidelines, you're fine. Like, you should have confidence in what you're doing. As long as you're familiar with your patient, you've read their history, and you know what's going on, you should feel confident in using UpToDate and making the decisions for your patients.
So what you're saying is that sometimes they don't know what tube the minutia was.
They don't know what minutia is, so they're like, I didn't know it was in a tube. Hold on, let me go back. Exactly.
But it's true that, a lot of them, the ones obviously who are more experienced have seen these issues before and, they kind of know. But
yeah.
even when they don't, sometimes they'll refer back to whatever app it is, medical app, to kind of confirm things. I know one of the providers that I work with, he reads a lot of studies and he'll say, well, this study says, well, this study recommends, well, honestly, they don't do that anymore because I've read a new recent study that shows, so one of them's a big reader on studies. So
well, that's important too. Staying up to date with,
absolutely
the studies and the guidelines is just like, the more that you study, the more that you go to the conferences, the more that you read, the more confident you're going to be.
But I also think we have to be careful, and it's important to remember each patient is different. Each person's unique, right? And what works for this person may not necessarily work for that person. So that's why it's important to listen, have an engaged conversation with your patients. They're not just, a person who's, this is the medication that's supposed to work and this is what I'm giving you. No, it's about how have your do you experience side effects? How, what are they? Mm-hmm. And understanding that so you can put it together so you can say, okay, I think this might be the better option, this medication or no medication. Right. And let's work on diet and, and see where we get. Let's try this test. A lot of times when I'm prescribing cholesterol medications and statins and stuff, not everybody can tolerate statins. And there is a lot to know about that. Diet, right? Familial history, how they tolerate medications and, what their side effects have been in the past and trying different avenues. It's not necessarily, you don't have to put everybody on a statin. Some patients, want to take calcium test scores to see if they've got plaque buildup in their arteries. It's not usually covered by insurance, but if they're willing to pay out of pocket, it's a minimal cost just to identify, do they really need to be on a statin? So everybody's different. Some people want to be on statins. Some people hate them, so it's so hard to put everybody in one category. You can't.
Right.
So yes, is it more time consuming? Absolutely. But it's still, it's satisfying when you can help somebody down their path, not your path that you think is,
Right. Exactly. And then also for like radiology, one of the doctors I worked with, she'd be like, order this. And I think, how does she know to order that? And then if you just read the radiology report, they're just going by the recommendations that the radiologist has set themselves. So it's not like they know what step to take, or maybe they do, but they're just reading what the recommendation of the radiologist is. So that's just something to keep in the back of your head. Read the reports. It's important.
So how do you get over when you're with a patient and you're not really sure what diagnostic tests to look for, what to do next? Like, do you always ask, or is there a place to look that up? Or are you taking the time when you're in the room with the patient to look that up? Or are you stepping out of the room to go look that up? How do you handle that when you're faced with that?
Sometimes I will look it up. Sometimes I will come out of the room and I'll sometimes say, this is what I'm going to order, and I'm almost there like, okay, I think this is the best thing. But I'll come out and I'll talk to one of the providers and I'll say, listen, this is what's going on. What do you think? Like I had recently a patient with like an anomaly, like bone growth next to his ribs that is common, but he was very concerned. It was causing him a lot of pain and it shouldn't really bother them. So I'm like, all right, do I order a CT of the chest or do I order it of the abdomen? Like, could it, because he also had cirrhosis. So I'm like, is it related to his spleen? Like, is it related to the cirrhosis? Like, I don't know. Like, what do I do? And you don't want to order so many tests, right? So, I talked to one of the other providers and kind of got what he would do and made my own decision. I didn't say, what should I do? It was like, this is what I'm thinking, and he said, well, and he always does this. He'll say, well, if it were my patient, I would do this. And this is why I would do that. And I'm like, all right. And then I kind of make my own decision.
Right. Sounds like he's very easy to work with. That's a nice way to
super
approach
easy.
it.
Yeah. What about you, Christina?
I think initially I left the room a lot. I'd be like, hold on. And I would go out. And you know what? For the most part, they're all okay with it because the patients just want to have the right treatment. So I would just be like, I just want to make sure. Again, I didn't have my own patients, so I would see this provider's patients. So they were okay with me checking in. I just want to make sure that this doctor, is in line with what I'm thinking. So I'm going to just go speak with her and then I'll be back. And I never had any issue like somebody saying, well, you don't know, you should know this. So thank goodness. I think it's all in our own heads. We have put so much pressure on ourselves, but you just have to realize that the patients, as long as they can see that you care and that you want to help them, along in their journeys and whatever they're dealing with, they're not going to have an issue with what you do.
I agree.
I had read something that said that Maya Angelou and Albert Einstein both had documented imposter syndrome. And Maya Angelou, it was like her 11th book, after she had written her 11th book, that she publicly said that she had imposter syndrome. She couldn't believe that she was a writer. She believed that people would find her to be a fraud, that she, I guess, didn't have the confidence. Can you imagine?
That's unbelievable.
I thought it was kind of amazing to hear that, and it was repeated. I found it all over the stuff I was searching on, and then I think recognizing it too and knowing what it is maybe helps. Although I know what it is and I have it all the time, but I'm not working as I'm not a nurse. I am a nurse practitioner, but I've seen like a handful of patients for research and not for anything else at this point in time. But I still have that sensation all the time. I remember years ago, it was at the time that I had already transferred. I was an RN and I had moved into doing research, and somebody gave me a gift, a beautiful gift. And it was a willow tree. Did you ever see those from Hallmark?
Oh, I have a ton of them. Yeah.
Somebody gave me a willow tree. It was like a nursing one. And I stood there like an idiot. I mean, I'm still so mad. It's so stupid, but I was so mad at my reaction to it because it had nothing. The gift was so beautiful and so thoughtful and from a very good friend of mine. And I love it. And I have it. It's in my curio cabinet downstairs. But when she gave it to me, I just stared at her for a second, and she's like, do you not like it? And I'm like, no, I love it. It was so thoughtful. I'm like, but I don't feel like I'm a nurse. I said that to her. That was my response. And then I was mad at myself, and I'm like, I am a nurse. Because it was so ingrained in my head that I wasn't doing the same kind of nursing as a bedside nurse, that somehow I was less than that. And I have felt that for a very long time. And I don't know where that comes from. I don't know if that's a self-esteem issue on my part.
It probably comes from the education. Like, you feel like they're molding you to work in a hospital or whatever. And if you do something other than that, then maybe that's why you feel like that. But I think if you're making an impact in people's lives, and everything that you're doing makes a difference, then I think that's what matters.
I mean, the other experiences I've had with it are, at one point in time, I went to a local system to get a job. So I wanted to do infusion therapy, like IV infusion for oncology. And I had an interview with somebody from HR. And in the interview, the woman said to me, "You don't have any clinical experience." And I said, "No, I do have clinical experience. I've been a research nurse for 13 years. I said, and I see patients every day. I see patients all the time. I do head to toe physicals. I do med reconciliation. I do EKGs. I do blood draws. I do some small little procedures and things, all sorts of nasal swab. I do, all that stuff in a clinical practice." And she's like, "Well, you don't really have the experience that we need for this job." And I remember feeling like so defeated, like,
yes.
And again, like an imposter, like as though she had called me out on my fraud. Oh, I was like, I remember leaving there thinking, I guess I'm really not a nurse, but I am a nurse. But
yes, you are.
It's just interesting. And then it happened again when I was just newly graduated and I was interviewing for nurse practitioner positions. And a couple of times they were like, "Well, you've been in research for 13 years. And I'm like, but I'm seeing patients in research. I see patients all the time.
Yeah.
In fact, I'm seeing them like I'm doing head to toe physicals on them. So my physical skills are in a good place. Like I have experience doing that, but they were not seeing it. It was very strange, and it only contributed to feeding that imposter syndrome because I already had that. That's underlying in me, and so then when it's pointed out to you, you're like, "That I'm busted. That's it." Not really a nurse practitioner, I guess. You know, like,
Yeah.
You know, even when I posted, like I just posted recently on Facebook for Nurse Practitioner Week, and I actually had the thought, I was like, people are going to be like, she's not working as a nurse practitioner.
Oh my gosh.
You know, it's like, thankfully I work in a job that they repeatedly say to me, and it's so nice to be built up a little bit, but they say to me, we need your expertise on this. We need the nursing perspective on this. There are actually a couple of nurses in unique positions as part of the organization that I work for. There's a nurse that works in finance, and there's another nurse that's a medical writer who does all sorts of medication research.
And they are nurses too,
They're
just
nurses,
like you are.
Yeah.
So,
Yeah.
and NP, whatever, you know, it's just crazy.
Yeah.
It's an unfortunate thing.
It is, but I think that our goal here is like, I don't want anybody to ever feel like that. It's not right. You have the education. You are, I think we said this in another episode. It doesn't matter where you're a nurse. What matters is that you are a nurse.
Right.
And I try to have that always come to the forefront, but it doesn't always. And it's hard. It's like a battle. You're fighting that sensation. But I think as long as we know what it is, and you just keep moving forward and know that you've learned how to learn, and that you have the resources, and that you know how to ask questions, and you know what you're talking about, to ask the right questions to get to the answer. If you don't know that answer, it's okay. You don't have to know the answer. You can find the answer.
Right. As long as you're willing to, use your resources and, I mean, this is healthcare. We should all be working together,
Yeah.
Right.
So.
Yeah. It should be, but that doesn't always happen.
So true.
Yeah.
Because, this is healthcare.
This is healthcare.
There's two sides to that coin.
Healthcare needs a revamp.
Do you remember when, as an RN, like, do you have that moment in your head of when you felt like, I'm a nurse, I'm here, like, I'm a nurse? Do you remember that?
I think it was like a gradual process. Like, once I got to learn all the medications I was giving, because I was on a specific floor. I was on a cardiopulmonary floor, so I understood the EKGs and I understood everything. And I had, there was a doctor once, and at the time it was very offensive to me, but like I would call, he saw me once call, I think it was a doctor, I can't remember. And, I wasn't sure in what I was going to say, and I can't even remember what happened exactly, but he was like, you need to stop and think about what you're doing and what you're saying before you make the phone call. Like, kind of play that out in your mind and then do it. But, you're on the floor and you have to do this and you have to do that and you have to do this and you want to make sure that you get everything done. So you're doing this and you're making the phone call. You're not even thinking about what you're doing. At the time, it was very irritating, but it was very good advice. Like, just to take a moment and kind of
Gather your thoughts and
present
this soap note, right?
Exactly. And just like formulating everything and kind of understanding. Like, there was this one doctor who was just, oh my gosh, she was amazing. Dr. Lee, do you remember Dr. Lee?
Vaguely, yeah.
I remember just calling these doctors all the time and I don't even know if this it pertains to imposter syndrome, but I think it does. But I would call these doctors all the time and I would just I would forget. Because I was so new, I would forget why I was calling, so that when they would pick up the phone, I'd be like...
You get so nervous to call them. It's nerve-wracking.
Yeah. So I called her once and I was like, oh my God, I don't remember. She's like, Christina, hang up the phone. And when you know what you're going to say, call me back. But that was nice. Whereas the other docs they would make me feel like I was an idiot. Like, really? But I think that all comes with time and with confidence and just knowing how to juggle everything and looking at your labs and whatever. But yeah.
I get the impression in medical school that they spend a lot of time on that report piece that, you know, I have a 57-year-old male presenting with blah, 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 you know, history of da, da, da. Because I, as an NP, was under a physician for my pediatrics rotation, and he would grill me, and I could never get the report right. I could never get it right. And I thought to myself, we don't do it like that in nursing school. It's a little bit different, but we should do it that way. Like, we should know how to do that. But I remember I would write down, like, for myself and then try to memorize it before I would talk to him, because I was waiting for him to go, nope, what about this? What about that? And I was like, oh, I didn't get it right again. You know,
we did that on the 7th floor, and it was, I remember, like, talking about being an imposter. It would get to me to give report, and my mind would go blank. I wouldn't have any idea. Like, I took care of these patients all day long, and I'd be like, I don't even know what to say. And I think, I mean, obviously that's very common, but it's just like you feel like an imposter, because, you know, your mind just goes blank, because there's just like people are looking at you, and it's overwhelming and it's scary. But with time, it just comes. And you could do 3 different things and still give report, but it just takes time and it takes practice.
Yeah. I remember one morning in rounds on the ICU with a doctor whose name I won't say, but you'll know who he is. He wrote a book. And
it's a he.
And he would do rounds in the morning, and then sometimes he would randomly it felt like he would pick on a particular nurse each day, right? So this one day, I was still new. I wasn't there that long. I don't even know if I was off orientation yet. And I had to report on my patient in rounds. And I said everything. I did say everything, but I didn't say it in the right order. And I realized it. So when I realized I missed something, I went back and I said it. And for whatever reason,
Too late.
He decided to totally berate me in the group. I mean, like, he was cruel, mean, nasty. And do you know, Judy Kinkle pulled him aside and said, don't talk to my nurse like that.
Good.
She did say that. He's like, you didn't say this. You didn't say that. And Judy was like, she did say it. And I remember I think I cried. I cried a lot when I was in the ICU. I think I cried the whole way home. Of course, I stewed on it all day and thought, okay, I have to get better for this. I have to get better. And I would go home and like practice doing that report. And he, you know, and then Judy came over to me and she's like, I'm really sorry, you know, and I go, today was just my day. I go, it seems like every time we do these rounds, he's picking on somebody. And today it was my turn. Yeah. And she laughed when I said that. And I was like, I did say that. I did say whatever it was that he was so pissed off that I missed, that he said I missed. It's because he didn't hear me, because I didn't say it in the right order. Right. But I was like, I did. She goes, I know you said that. And I talked to him about it. Good. But, you know, it's again that imposter syndrome. Here you are, you're so nervous but you're trying so hard. It does kind of make you better. It's like, you know, it's like how you tell your patient there's different levels of anxiety, right? So anxiety can drive you. Anxiety drives you. It makes you want to do better, want to be better. I go, when it becomes a condition that prevents you from doing things because now you're frozen, then that's a problem. Then we gotta look at a diagnosis for that. We gotta possibly think about what can we do to resolve that anxiety. But it's the same type of thing. Like, this imposter syndrome causes that anxiety, which can be really good in some situations and really bad in others.
Right. I remember being on the 7th floor, and there was this one nurse that nobody liked to give report to, because she would ask you, she would grill you, grill you. So, of course, you're the new person. The new person had to give report to this one person. But that always drove me. Like, if I knew, I just assumed that I would be the one giving a report. I would actually go in and look and see who was on that night, because I knew that I would be the one giving a report. But it did drive me. Like, I knew my patients, man, backwards and forwards and whatever, when I knew I had to give report to her. So it does drive you, but it's scary. And then as a nurse practitioner, it's, you know, the important thing is that you're taking care of your patients, okay? And you just have to know that it will come, and feeling like an imposter is very normal. Everybody feels like that. Nurses, we just spoke with a nurse who's been a nurse who's a nurse practitioner now, but she's been a nurse for decades, and she still has those moments where she feels like an imposter. And it's just, it's normal. So don't make it something that deters you from what you're doing or makes you feel bad.
Oh, Nida, do you remember the day that you were a nurse or a nurse practitioner? This is it. I'm here.
Yeah, I was like, it was hard, it's, so many feelings and emotions and apprehensions and, excitement too, here I am doing this, I'm really doing it. And, there's always going to be good days and bad days, and that's with everything. I think it's important to just stay focused on what your knowledge is and what you've already accomplished, and just knowing that no matter what, you're going to be faced with challenges. And that's okay. Those are good things, because that even mistakes, I don't mean harming a patient, but like mistakes, it's okay because we learn from them, and we need to always just press ahead. Never look back at the things that you did wrong and messed up, just look ahead at what you're going to do better and what you've learned from that.
Right.
It's not always easy, but that's when prayer comes in for me. and just knowing and trusting,
Right.
Yeah.
Trusting in your knowledge and the support of your colleagues too.
And that's why it's also important, the more that you know, the more that you feel confident in your practice, the less you'll have those moments of imposter syndrome. So just make sure that you are doing your continuing education credits. If you're in a specialty, keeping up with the information. If you're in primary care, just keeping up with pretty much everything. Just going to the conferences and keeping up with the knowledge, because that'll help with that imposter syndrome.
Yeah, it'll help keep you focused. It'll help keep you fresh and, new eyes and new treatments, right? New protocols and just, so that way you don't ever put yourself in a position where you're like, I don't know.
Right.
As much.
It's okay not to know.
Right.
And I think, as long as you are always willing, you can even tell your patients, I don't know, like you said, and you can look it up with them, or you can just be like, I'm going to look into it and I'm going to let you know. But just, just that honesty and keeping that, that trust open definitely makes a difference.
For sure.
I agree. For more information about imposter syndrome, check our show notes. Shout out to Alicia. Happy birthday, Alicia.
Happy birthday, Alicia. We miss you.
We miss you.
Yeah.
Thank you for listening.
If you like what you're hearing, please subscribe to us and give us 5 stars.
If you have any ideas or comments, please message us at 4npspodcast@gmail.com.
Please follow us on Instagram, Facebook, and Twitter at 4NPs Podcast. That's the number 4NPS Podcast. Subscribe to us wherever you get your podcast, and go to our website at 4npspodcast.com for episode transcripts, resources, and more information about us.
Please join us next time when we speak to 2 nurses. One is a nurse practitioner student who is soon to graduate, and the other nurse is a nurse currently working in a hospital who's actively thinking about going back to school to get her nurse practitioner. It was a great conversation, and we hope you enjoy. The information in this podcast is for educational purposes only and should not be used in substitute for professional care by a medical provider. The information in this podcast does not represent medical or other professional advice or services. The thoughts and opinions presented on the 4NPs podcast are of the hosts and guests and do not represent those of their employers.